So I think the idea for spreading was just looking in your everyday life and finding things from within that that can be turned into service for a larger, sort of community audience, or purpose. So for me, one was being an anesthesiologist, and a crucial part of anesthesia is meeting your patient before surgery and having a chance to talk with them, and using that time to sort of allay their fears and answer their questions. And there was a lovely study done looking at the fact that talking to an anesthesiologist before the surgery had a greater calming effect than using medications to calm a person. So talk therapy. So using that idea as a way to help demystify the healthcare system for people who weren't so sure how to access it or what to expect when they did. And that's kind of universal, but it certainly was important in the community in Boston, where there were a lot of people who, a block away from the greatest health centers, weren't getting the type of help they needed. It's being observant of the world around you and what you see. And when you see something that needs to be done, sort of seeing things around that will help you make it happen.
Yeah.
So it's sort of connecting.
Right.
Connecting an observation with a new purpose. When you look at technology, the big deal these days is the massive online courses. I think they're fantastic, but they fall apart if that's all there is. You need at some point to actually touch someone and talk to someone. So I don't think it's an either or. I think it's both.
Yeah.
And you need without the technology, the two programs that I'm part of wouldn't be where they are.
Right.
They're essential to our survival. But in the the end of the day, both programs is about actually getting close to someone and talking to someone and touching someone and doing something.
Yeah.
So I think you need both.